Good afternoon, and thank you everyone for attending today's webinar, IT Security and Compliance, The Essentials, presented by Nelson Gomes of Priority One Group. Please be aware that there will be a question and answer portion today at the end of the webinar. To avoid frequent interruptions during the webinar, please type your questions in the question box located on the right of your screen. They will be answered in the order received during the question and answer portion. Additionally, an electronic version of this presentation will be emailed to all participants following completion of today's webinar, and a recorded version will be available on the website for members only. Again, NJMGMA would like to thank you for attending, and I will now turn things over to Nelson.
Well, good afternoon, everyone, and thank you for joining. My name is Nelson Gomes. I am the CEO and President of Priority One Group. We're an IT managed services company that with a heavy focus in healthcare. Today's webinar will be IT Security and Compliance, The Essentials. So I want to start off with a very common and theme with youngsters as of today, where it seems like they know more than us adults when it comes to technology. So I wanted to put this cartoon out there just to kind of set the tone. So I wanted to make sure I share that with you. So today's goals: understand the 7 layers of security, and I will try to keep it as simple and as non-technical as possible. Identify top patient privacy and security concerns. I think it's important for everyone to understand what are we hearing back from the patient community in regards to privacy and security. Discuss some of the common compliance and security errors medical groups are making. Provide practical guidance for maintaining proper IT security. I also want to take some time towards the end of the presentation where I'm going to provide you with some simple security measures every group should have in place. So here, this is a common theme, right? I'm sure many of you have heard about millions of patient information being stolen or being hacked. It seems like healthcare is a big target, and I can tell you that unfortunately it's going to continue that way. And all we can do is do our best to put in the best practices so that we can secure that data. So for those of you that know me, you know that I'm very big into stats, and the numbers always tell a story. So these are the next graph that I'm going to share with you. This is actual data that came from HHS. And we compiled it in this format so that you can have an idea of exactly what the numbers are saying. So this is, for those of you not aware, if you have been breached and it affected more than 500 individuals or more, you're supposed to be providing that information to HHS to let them know that you've been breached. And this report and this chart that I'm sharing with you is showing the cause of the breach by the number of incidents. So just to kind of break it down, and this information was as of last year as it was compiled. So theft is 49%. Unauthorized access disclosure, you're looking at around 20%. Hacking is around 10%. Loss is around 9%, and then you have other. This other chart shows you the type of media and by the number of incidents. So paper and film. So this kind of relates more to film being from diagnostic imaging centers, paper being actual patient health information on paper that I got in the wrong hand. So 23%. Laptop, so a physical laptop. So 20% of the incidents on the media, with media being laptops. Other 13%. Network server is also a large portion there at 13%. then desktops and portable electronic devices such as thumb drives and even phones as well. And email is also a 7% there. So, in summarizing, 91% of healthcare organizations report at least one data breach over the last 2 years. So there are several of you on this phone call that reported some kind of a breach. That's what the stats are saying. Cyber attacks are expected to affect 1 in 3 Americans this year. And based on some of the preliminary numbers, they're saying it's going to cost them. It's going to cost around $6 billion. Medical records are worth 10 times more than any credit card on the black market, and here's why. With a credit card, you're going to get your social. They're going to go after your social security number, your address, date of birth, and such. With a health record, here's how much more information they have. They have your height, they have your weight, they have your race, they have your blood type, they have any of the diseases, any of the medications that you're taking. So that the more information that they have, the more value of that actual record. So just the the social security numbers, date of birth, and address is just the tip of the iceberg. With the healthcare medical record, there's definitely a lot more value there, and that's why we are seeing an increase in healthcare facilities being targeted. Here's some additional stats. So on the left-hand side, we're talking about causes of breach by number of affected individuals. So here's the numbers that are going to hit home. So 105 million, it's just an astronomical number. So 73% of any of this incidents reported, again, this is reported, had to do with hacking, or it's an IT incident. So hacking, obviously speaks for itself. An IT incident could be that the data was compromised internally. It could be that it was on a laptop and that it was compromised that way. Theft is actual theft, and loss is the loss of the records themselves. Moving over to the next graph, you see the type of media and by the numbers as well. So again, a big number just on network servers. So they're grabbing all that information that are residing on network servers. Now, this is the major hospitals, the major carriers, small practices, large practices. It's all, unfortunately, cybercrime is not picky about who they go after. And then the smaller portion of email, electronic medical records themselves, other portable electronics, paper, film, desktop computers as well. So as I spoke about, data breaches are costing the healthcare industry about $6 billion a year annually, and more than 1,500 covered entities on the HHS Wall of Shame are reporting. I want to share this wall for you, so I'm going to, and if you go to this website here, it'll show you exactly, and you can do some filtering to see exactly. So I'm gonna go there real quick. Hopefully everybody can see this. Let me Google it because I don't know the exact. I'll do, and you can just Google it as well. Just do HHS Wall of Shame. It'll bring you right to it. And this is a good, and if you go to the show advanced option, this is a good way for you to really understand who's been impacted in your area, and you can actually filter it here to see what type of breach. But I typically just go, let's look at New Jersey, for example. Okay? And then I can also get into more granular and kind of figure out how I want to get that information. But I'm just going to do it by state and here. And it's generating a report. And as you can see, this is going to provide me with, there's 23 pages. So I'm just going to go over one of these. Now, this is all public information. So this is telling me what state it was, the name of the covered entity, what state, covered entity type, so was it a business associate? So an IT firm is considered a business associate. The individuals affected, the date the breach was submitted, what type of breach, and the location breached information. Now, I can, at one point, if I just click in these boxes, it'll sort it that way. And you can do it from highest to lowest. As you can see here, Horizon, this is showing that their breach out back in 2014 of a laptop, and it affected 839,000 individuals. So I think this is a good place to kind of take a look, and what you'll see is what covered entity got affected and if it was a business associate. Business associate can be myself, can be a billing company, can be a number of things. So if you're in the market of looking for a business associate you're going to do business with and you want to get references, this is a good way to kind of cross-reference that. So once again, the information, if you just Google HHS Wall of Shame, it'll give you all this great information. I wouldn't actually call it great, but it's information regarding breaches that took place. So going back to my presentation, we're going to talk about the 7 layers of security, and again, I'm going to try to keep this as simple as possible. Physical obviously has to do with the physical security itself. So whether you have all your servers in the data center, whether you have all your servers in a small closet, how are you monitoring those systems, access to those systems? So that'll be, that's considered physical. The network itself, so what kind of hardware, the hardware layer on the infrastructure side, so what kind of firewalls are you using, what kind of switches are you using, any of the routers that you're using, are you using business class type of equipment? That's the network layer. The application layer, so any of the systems that you're using currently in place, that's layer 3. What kind of data encryption are you using? Antivirus protection, patching, two-factor authentication, malware protection, and log management. Server, so the server itself, it doesn't necessarily mean the EHR practice management server. It can also be your file server where you're keeping files and the integrity of that data and the integrity and patching of the operating system. Data, the data itself, how are you backing it? How is that data in transit or at rest? At rest would be basically data files that you're just saving there. Let's just say that's just files that you're accessing back and forth. In transit has to do, for example, email or information that that you're going, that for example, your billing company may be accessing remotely. They're accessing it remotely, but that data is basically in transition depending on how you're set up. So that's the 5th layer. How is that happening? So that's the data layer. Devices has to do with both mobile and medical devices, and the BYOD, so bring your own device, is one of the concerns as well, and another layer of security, and what you are applying and how are you applying it, and what processes and policies are you applying for these devices. Users. How are users accessing your data? What are the policies related to the data? What kind of password and policy that you currently have in place? Does everybody have their own account? Are they using, people are using generic accounts? So those are the things that you need to understand as far as the 7 layers of security. So just to recap, the different layers of security: physical, network, application, server, data, devices, and users. So one of the important aspects that I wanted to share with you is, okay, that's great. You have all this information. We're gathering all this information regarding security, and what are the different layers. But I felt it was important to share what some of the patients' perception is of healthcare record privacy and security. And later on in this video, we recently did a video outlining that, and we kind of asked some people out on the street and some professionals, and we'll get to that, and you'll see some of the things that they're sharing. But I wanted to share this slide with you because I think it's very important for everyone to have an understanding of what the patient perception is. As we all know, perception is reality. So I think this is a very important slide. So the first bullet point talks about a quarter of American adults indicated that they were confident, and approximately half indicated they were somewhat confident of their privacy and medical records. The third point, where it says more than 59% expressed concern about their security, that's somewhat alarming. I was actually surprised when I saw that number. But one of the ones that I think is good to note here is that adults with higher quality of care had significantly greater confidence in privacy and security of their PHI. So there's some good news. Adults with higher information value had significantly greater confidence in the privacy and security of their medical records and less concern about sharing of health information. So there's that, it's that confidence level. So of the patient really understanding what does privacy really mean, what exactly you as a practice are putting in place for privacy. And I know that as a patient, sometimes I'll go into an office, I'll just sign a HIPAA form, but unfortunately, there's not that. Okay, why? Why am I signing this? Why is it so important? So these are some of the trends that we're seeing, and all this information came from the U.S. Department of Health and Human Services. The University of Pittsburgh did some studies that where we gathered some of this information, and the National Institute of Health, National Cancer Institute of Science and Research and Technology. So this is some very important data that I really wanted to share with everyone. So what are some of the common security gaps? So one of the things that I wanted to outline here was security and compliance. They're two different areas. Our major focus is on the security side. Compliance is a totally different animal, even though we dabbed in some of it, but I wanted to share some of those. So we're going to discuss a little bit more of these security gaps. No risk assessment. I can tell you that from my experience, OCR, who is the Office of Civil Rights, who is the entity in charge of doing investigations, the first question they're going to ask you if you've been breached or if you happen to be audited, the first question is show me your risk assessment. That is the first question. And for those of you who are going to be attending New Jersey MGMA, I'm do a shameless plug here, is we're actually going to be a session that I'm going to be moderating that going to have OCR, the FBI, we have a healthcare attorney, and we're going to have a compliance officer there. So we're really going to go into a lot of this stuff. So if you're going to be attending New Jersey MGMA, highly recommend it. If you're not, you should sign up. Okay, enough of the plugs. So lack of safeguarding data from unauthorized individuals. So users often leave computers logged in while they are away at their desks. Also, some on-site security guards and physical controls fail to prevent unauthorized access to restricted areas. A walkthrough during after business hours can help providers identify whether unauthorized people can physically gain access to the protected data. So there should be, this is a simple fix. It's a matter of setting policies that if you don't log out, there are systems in place that you can create that automatically lock your computers. As far as the physical security of where your systems are residing, you need to put something in place. Monitor controls and key systems and check for inadequate logging. every time a system users access computerized records, whether it's through your EHR system or the practice management, they have systems in place that you can do auditing. So most healthcare organizations rely on access controls to help ensure compliance with HIPAA. However, security gaps occur when providers use antiquated systems that don't allow logging. So for those of you who are using an EHR or not, even if you are not using an EHR, you need to have some kind of logging system in place to understand who's accessing your system and if they even should be accessing your system, even though they might be within your organization. Create strong vendor management function. So understand what your vendor, so whether it be your IT vendor, anybody that falls under the business associate umbrella. Just because they sign, I'm going to get into this a little bit later on in the conversation, just because they sign a BA agreement doesn't mean they're compliant. Find out, ask the question, let them give you actual proof that they have guidelines that they are following. Non-existent business continuity incident response plan. I go back to having something in place that has to do with business continuity. So if there is a catastrophic failure and you need to go to paper, do you have it in writing? What are the plans that you have in place? And if it's just not a matter of having it in writing, it's important that you exercise it, that you check and see if it's working. Deficiency in technology standards. I can't tell you how important this one is. Time and time again, we are seeing lack of standards across the board. What do I mean? Well, we are seeing that physician practices are not using business class type of equipment. That they're buying computers at Best Buy or at Costco. Those are not business class machines. Your IT provider should provide you guidance to say, here's our technology standards. Here's what we call a stack. And we've already vetted through it. We've already gone through the process. These are business class machines that meet your organizational standards. One, there's going to be security concerns to ensure that those devices have the proper software and meet the proper requirements to provide adequate security, and not only that, but that they meet the standards of whatever EHR and practice management that you're using. And again, it's easier now not only to maintain and to upgrade and to provide patching. So once you have a uniform hardware setting in your environment, it's just that much easier. I highly recommend it. Now, one of the challenges that I know that that practices have is they all can't do it at once, which is fine, but have a plan in place. Talk to your IT vendors and saying, they should be talking to you at least twice a year to say, okay, here's what we're seeing in your environment. It doesn't meet the standards. You should think about replacing this. And put a plan together, put a budget together to say, okay, in 3 months we're going to replace this. So that now you already have, as an organization, you can go back and when you're doing your yearly budget, you know what your IT budget is going to be for the following 6 months or a year. Technology standards, big deal. Lack of encryption, and we continue to see this, but the good thing is we're seeing an increase in awareness, which is a great thing, especially with emails. If you are sharing any type of PHI, it's imperative that you encrypt that you use some kind of tool that's encrypting. We're seeing more and more users going to Office 365. Office 365 is now included in their bundle. They have encryption, so it's part of the bundle. You have it, use it. At the same time, there are also areas where you may have to encrypt your data itself. But if you're using a practice management EHR, they already have some kind of encryption already built into their software. Ask the question. Okay, and I skipped some. Sorry about that. Okay, so those are some of the security gaps. Common compliance gaps. Again, no risk assessment. So security is one thing, compliance is another thing. It's important to definitely have that risk assessment. I'm going to go into the details of what you should be doing. Non-existent HIPAA training for staff. I think that that is a must. And from my understanding, and again, I'm not a compliance officer, but from what I know in my experience, is that everyone needs to be trained. Anybody that uses PHI, that touches PHI within your organization, needs to have some kind of official training. Now, there are third-party systems out there that we actually use to train our staff to ensure that they're following and they understand HIPAA guidelines. So if you're not doing it, you need to find a way to do it. Outdated policies. Policies and procedures keep changing. Are you keeping up with them? Or do you have this huge binder on your shelf that has 1,000 pages that you wait once a year to go through? There are new tools out there on the market where everything is online. You don't need that big binder up on top. We use a third-party system that helps us with our policies and procedures as they refer to HIPAA. We have to follow the same guidelines as an IT provider that that does business with covered entities. That we need to follow the same guidelines. So we have a third party where we do the training for our staff, where we have our own policies and procedures, that we have our breach notifications, that we have all our policies set to disaster recovery and business continuity. So it's an online system, and to be quite honest, it's very simple to use, and at the same time, it gives you some sanity, because I know that can be very time-consuming. Inappropriate access of PHI. What I mean by that is there are users within the organization that don't require access to PHI and have access to it. So doing an audit on your, on your systems to say, does this person need access? And if they don't need it, why are we giving it to them? So that's again a process that you should be doing on a regular basis. One of the things that we found and that we implemented for some of our clients was when you hire someone, go through the process and identify exactly what the requirement is for that person. And one of the things that helped is, we've used other people within the organization to compare with. Okay, Sue is a billing person and she needs access to X, Y, and Z. We just hired a billing person, so the same rights that Sue has, this new person needs to have. And unfortunately, what happens is more times than none, a user are getting more access than what they really require, and that can be dangerous. No documented security program, highly recommended. So what are you doing about security? What are your policies and procedures about security, surrounding security? Failure to keep up with regulatory requirements. This can be difficult. And once again, having a third party to help you goes a long way. It certainly does for us. It's very hard to keep up with it. Poor and non-existent agreements with business associates. And again, just because they sign a business associate agreement, ladies and gentlemen, doesn't mean they're compliant. And you saying, well, they signed the business associate agreement, I'm covered, is not adequate enough. We use the term of sticking your head in the sand. Well, listen, they signed it, we're good. It's not, when an OCR asks you the question and they give you a BA, and you say, well, here I have a BA agreement, it's not going to be enough. They want to go back. So I highly recommend any business associates or any vendors that you're using that touch PHI, not only should you have a BA agreement, ask them for their guidelines. It's your right, and if they don't give it to you, that's a red flag. And to continue on that, what we're seeing is we are working with a lot of practices that are claiming, well, our current IT has signed a BA agreement, and my follow-up question is, do they provide you any guidelines? And 9 out of 10 times they don't. And unfortunately, when you do and you're doing your research and you're looking for a vendor, just because they say they're HIPAA compliant doesn't mean that they are. There's no such thing as a HIPAA certification. So if anybody's telling you that they have a certification that they're HIPAA certified. There's no such thing. They can be certified by a third party. The last time I checked, HHS does not provide you or any entity with the certification. So it's a certification that I can say, well, yes, I certified myself because I went through X, Y, and Z process. So if anybody tells you we're HIPAA certified, is not true. Email, text messaging, and social media, we're seeing this as being more and more of an issue. And it's one of those things I go back to educating the people in your organization, especially doctors. Doctors feel as if they can communicate back and forth with some of the staff with patient information, and they should not via text. There are applications out there that you can use in order to ensure that that conversation is being encrypted, and you can use those safeguards. And again, we're seeing more and more, unfortunately, with organizations where patient information or discussion about a patient is being put up on social media. That's a big no-no. And also, where if you're an organization, you need to have someone that is designated as your privacy officer. Okay, so let's talk about the myths. No one is ever going to check us. That's for hospitals and large practices. That is so far from the truth. Enforcement is up for all sizes and practices. And now with the new rule just coming out, you're going to see OCR now doing what they call desktop visits, where they're going to come unannounced and going to go through your process. There's more to that. Again, highly recommend. That's a big topic that we're going to talk about in our breakout session at New Jersey MJNA. So that's an important topic, and we're actually, OCR is going to actually discuss it. So we highly recommend that you attend that to hear it from the horse's mouth. I signed the VA from a vendor. I'm good. And that, we talked about that in the previous slide. No, you're not. Please find out. Ask the question. If you are signing a business associate agreement, do you have, please show me a list of your guidelines that you have and the policies that you currently have in place. They should be able to produce that for you. My hospital is HIPAA compliant. Now, I wanted to bring this up because it's very important. We're seeing more and more how hospitals are partnering and purchasing and bringing on new physician practice into their organization. There's two different models. There's the buyout, where they totally buy out the practice, or they lease. Just because you're a part of that, let's say the lease agreement, you still have to adhere to your own. As if you're being purchased by the hospital, then you have to follow those hospital guidelines, and I'm sure that that's part of what they're doing in their due diligence. But don't automatically assume that. Ask the question. Texting patient management is okay. It's not okay. It's okay if you have the right tools. And once again, we're seeing more and more technology advancements in healthcare, and it's all about encryption. So there's a lot of tools out there. Just make sure that when you go through the evaluation process, you ask the right questions. And make sure that you have an IT vendor that understands the importance of security, and have them be part of that process. It's very important when you're evaluating any new product within your networking in your organization, that you include IT early on to say, hey, this is what we're trying to do. We need you to be part of that conversation. Because 9 out of 10 times we find that the organization is not asking all of the right questions. So that's why we're IT needs to be part of that conversation. It's not going to happen to me. Again, sticking your head in the sand is not something we recommend, and it's a myth. So please understand the importance. Improving security and compliance. So here's some of it's not a top 10, it's more than 10, but list of things that you can do. Top of my list, conduct a security annual risk assessment. Do it. That risk assessment should basically identify, should be like a report, and that report should actually identify your gaps, lay out all the findings, and in addition, with that risk assessment, you should have some kind of remediation plan. where it says, here are some of the things that you need to address, and here's how you can address them, and here is how long that's going to take you to address them, and here are the costs associated with that. Because when OCR comes in, they're going to want to see not a risk assessment. If they see a risk assessment, they also want to see a remediation plan. A prime example was during several years, I think it was in 2014, when Windows XP was being discontinued, we saw a lot of IT firms out there using scare tactics and saying, well, if you don't upgrade all these XP machines by X amount of date, you're out of compliance and you're going to be fined and blah, 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 blah. And that's far from the truth. What we did with other, what we did with other clients is we formally documented the process to say, for example, this client XYZ has a total of 30 machines that are running XP, and the plan is to replace them between month 3 and month 9. So within a 6-month period, we're going to replace them. As long as there was a plan in place, you have to show that. So not everything can be done all at once. So as long as you show good faith that you're looking to improve that and that you've made strides to do it, OCR is going to definitely look at as a positive thing. Annual penetration testing. This refers to what we call a pen tester in the industry from the outside, and this again is a managed pen test where organizations understand when it's going to happen, and what we're doing is we're going to act as hackers to see what we can get through and what we can't get through. And that, once again, that's going to provide you with a report with the gaps, and then understand what you need to address within those gaps, how you're going to address it, and the time frame that you're going to address it in. But annual penetration testing is a must. Quarterly vulnerability scans. This has to do with internally. Now, quarterly, you can do it. But if you do it biannually, it's also acceptable. It's more of a running a scan. It's like a pen test, but internal to your network to identify any vulnerabilities within security within your network. And there are tools that we are using now for our clients that it's already set. That's already set and scheduled, and those reports automatically kick out every quarter, and then we provide it to those clients. So. These are the top 3. If you're going to do anything, these are the top 3 that you need to get done every year. Web filtering. This is a big one as well. One of the things that continues to be something that we're seeing is obviously ransomware. Ransomware, I'm sure everyone has heard about it, and I can tell you it's here to stay. It's going to continue to grow. It's a matter of making sure that you have the right safeguards in place to avoid it. So web filtering, having a way to filter web traffic for your users is very important. So that it doesn't get to that stage where somebody's going to a website where they're not supposed to be going to, mask to something else. There are third-party products out there, and it's part of for us, for our clients, and it's one of those things that we include in our managed services as a service, that we're scrubbing all that internet traffic to make sure that internet traffic is accurate. And at the same time, we have the ability to report on where the user is going. So if they're going to places where they're not supposed to be going, we can provide that report. At the same time, there's filtering in place where you can set up groups to allow certain users a certain type of access to the internet and other users a different access. Obviously, we all know that doctors want to be able to get to everywhere they want to go, and we have to give them full internet access. It might be users within certain departments of your organization that only need limited type of access. I can tell you that it makes a huge impact, huge, especially on performance as well. Incident response and business continuity planning. So having a plan of when an incident occurs that needs some kind of immediate response, whether it's an outage, whether it's a breach, whether it's a backup, and that you need to restore, there should be a plan in place, a defined document that you're going to refer to and at the same time that is available and should be part of your security and compliance and business continuity plan. Test it on a regular basis. Do it at least at a minimum twice a year. Understanding your data, what's sensitive, where does it live? You know, the complexity of IT and healthcare is going to continue. The only thing that that is going to change is how are we as an organization protecting that information. So it's important to really understand where your data resides, who's accessing it, and what's sensitive as far as who gets to see what. So have that understanding. If you don't have that understanding, reach out to your IT company, ask them about how this information is being accessed, where it resides, how do we back it up, what is the time that it's going to take to restore. Understand that. It's very important that you understand that. They should, you know, they should be able to provide you that. They should have their own internal plans and how they're going to do incident response when it comes to you. So if there's a breach, what are they going to do? Is it something that they're going to do? Do they have a third party that they're going to do any forensic stuff? For example, you know, when it comes to these breaches, and if we get breached, we have partners that's what they do. They do forensic investigation. That's not our cup of tea. That's not what our skill set it is. But we've partnered with the right people, especially with healthcare in regards to security. So ask the question. Review practice management and EHR audits. Both those systems, each one of those have audits within them. It's one of those things that, you know, you maybe want to do once every quarter just to see where your users, you know, randomly pick a user, you know, and an instance and see where they're going to see if what they're doing is adequate, and if it's not, now you know. But if you don't audit it, you're not going to know at all. Oop, I missed something. Sorry about that. Okay, do that. Provide ongoing security and compliance education and training. I think that we see a lack of this within the organization, within organizations. This needs to be a priority. Your users need to understand the implications of security and breach. They need to understand the importance of maintaining HIPAA and understanding of HIPAA. So I highly recommend that if you don't have some kind of a training program, that you put something into place. And what we're seeing more and more is, like I said, those third-party companies that are out there that they're doing all in one. They're doing the compliance, they're doing the training, they're doing the policies and procedures kind of all in one, so to make things a little bit easier. Because I got to be honest, you know, if you asked me that question 4 years ago, I would tell you that that was an area where we struggled because there's so much. So having the right partner to help us in that area made a huge difference for us. Establish and maintain compliance and security policies and standards. That kind of falls in with what I just talked about. Develop a process to audit your rules. So you should have a process in regards to your audit rules. So whether you're auditing a medical record, whether you're auditing an email, whatever you're auditing, you should have a process in place. Implement physical security controls. So if you have a data center and it's just, you know, you have a key and that's it, perhaps put a video surveillance or put in a key code where you can get information from it. There's a lot of access control systems that you can do there. Again, it all depends on your size, right? But use the right tools in order to be able to audit that. Encrypt your mobile devices. I mean, that's a no-brainer. If you have any, and you shouldn't have any PHI on laptops, period. Your laptop should just be a mechanism for you to access PHI, but I highly recommend to be safer than sorry and just encrypt it. There are systems out there that you can do it. If you're going to do it, make sure that you have the encryption keys for those, because unfortunately we've seen where people do encrypt them, and the laptop needs to be rebuilt, and you can't rebuild it. You'd have to buy another hard drive. So if you're going to encrypt the laptop, make sure you have the decryption keys in a safe place. Confirm that business associates are following HIPAA rules, and we talked about that. So don't just go by they signed your BAA. Ask for that set of guidelines that they should be following. Keep up with the changes in rules and regulations, federal, state accreditation. This has to be the hardest piece of it, especially from what I can see. It seems like it's just just a job alone to have somebody just to kind of do that. Currently we have 4 security officers within our organization, and it's kind of this ongoing beast that keeps growing and growing and growing. We're trying to keep up as best as we can. We've been successful because we partner with the right people to kind of provide us that guidance to make sure that we're on top of things. But it's a struggle, it's a challenge, but it's one of those things that we just can't ignore. So I wanted to provide a little bit of this slide because I think it can give you an overall picture of, okay, what are the investments I need to make up front in order to secure and follow best practices for security and compliance. And this, I grabbed this from PwC, who's a research company that basically came up and said, $8, your investment is $8 per patient record for security. If you don't do it and you get breached, it's going to cost you about $200. So the numbers speak for themselves. So I was pretty amazed at that, and I would definitely ask you to revisit their site to get into more detail. But I think it kind of provides you with an overall big picture of how serious this problem is. So security measures. Again, I'm just kind of recapping some of the things we talked about. Perform a security assessment. Make sure you have all business class firewalls in place, all business class type of equipment. Use strong passwords with quarterly resets, because having the same password just doesn't cut it. And I know that it can be a pain, believe me, but it's a matter of making it a routine, and once you do that, you'll get over the hump. Standardizing endpoint security, so when you do across your network and your machines, make sure that you have standardized versions of all your malware and virus scanning software that you have. Make sure it's on the same version, that it's being managed from one central location, because if you're just installing it on separate computers and one has one version, one has another one, it's just making things inefficient. So having a standard across the board and being able to maintain that from one central location is very important. That's part of also our managed services that we provide to our clients, is one standard that we get to monitor and update on a regular basis. Ensure operating systems and applications are being updated. This is part of your IT firm. Ask the question, they should be providing you with monthly reports on what's been patched, what's been updated in regards to the operating systems that these EHRs and practice management systems are working on. At the same time, if you have any other servers that you're using where you're accessing, whether it's an Exchange server for email or a file server where all your files are residing, it's important that those are being patched and updated on a regular basis and monitored. Email and mobile device encryption, we talked about that. It's very important that that if you're accessing the PHI, that you on mobile devices, that you use the proper tools in order to ensure that you're viewing it securely. Systems monitoring, it's important that you have monitoring tools in place to monitor not only your desktops, but your servers, on performance, on vulnerabilities, and on maintenance. And then finally, your user monitoring. Actually, we have one more for this. Monitor your users in all aspects. What are they accessing? Do they have the right permissions? Are they visiting websites that they shouldn't be visiting? Are they logging off? Those types of things. Verify and confirm disaster recovery and business continuity. Don't just have a plan. Ensure that you test the plan. I can tell you that for most of the clients that we perform this for, it's a regular thing, and it changes every time because it's just not on the IT system. They look at how the staff reacts to what we call a mock disaster, and they adjust the plan based on how the staff reacts. With that said, I'm going to now share with you a video that we recently did that I talked about, that we went on the streets and asked people some questions. So without further ado, okay, hold on. You're missing sound, I think. Hold on. Hold on. Sorry about that. Okay, let's back this up.
Cybercrime is plaguing healthcare in the United States. It's a growing epidemic, predicted to affect 1 in 3 Americans and cost $6 billion annually. How concerned should you be about healthcare data security? We took to the streets to find out the public's opinion regarding patient privacy, and here's what they had to say.
What expectation do you have of your doctor protecting your medical information?
I would expect them to keep it secure. That's my expectation, because I fill out forms when I go to the office, and I expect them to be within that office and given to no one else.
How would you feel if you found out your medical information was lost or stolen?
I'd be pretty upset and angry, because isn't it their job to make sure that everything is confidential?
Yeah, without a doubt, I definitely feel betrayed, and I wouldn't want to go back.
Oh, why?
Did you know that the government takes an online wall of shame that lists organizations with breaches of unsecured patient health information?
A wall of shame? That's disturbing to know. That's what you pay them for, to protect your information.
What would you think about a doctor if you learned he or she invested in security measures that help protect patient information?
That'd be great. I mean, it shows that they really care about their patients and that they're making the investments to protect your personal information. I mean, actually, I'm going to ask my doctor when I go back to see what they're actually doing to help protect what I have invested in them.
We met with healthcare professionals, the people patients most trust to maintain privacy. And here's what they share.
Why does security and protecting patient health information need to be a priority for healthcare providers?
Number one, it's the law. Enforcement is up, penalties are high, and they really need to be aware of that. But if that's not the main motivating factor, patients are expecting their healthcare providers to protect their healthcare information.
How do you think the opinion of a practice would change if we were to lose patient information or if there was a breach?
I think that if a practice breached information or any information got out, would be devastating to any practice, large or small. Patients expect great care when they come to your office or your practice or your surgery center, but they also expect their information to be safe.
Doctor, what responsibility do you feel physicians have to protect patient medical information?
I think the physicians have a very important responsibility to protect the patient's information because it builds confidentiality between us and the patient.
What are some of the IT security measures that providers should be taking into account?
The first one is to do a security risk audit. Along with that, though, they should do a vulnerability scan to make sure that all of their IP addresses are secure, and they should also be doing a penetration test. And they want to make sure whoever is doing that is qualified to do that. And once you've done it, you want to do it on some type of regular basis.
So if you had one piece of advice to give to fellow administrators in a practice or in a surgery center, what advice would that be?
The advice I give to any administrator or practice administrator is to number one is to understand HIPAA. Make sure your employees understand HIPAA, and make sure you use the right IT partner, such as Priority One, to be able to use all the tools that you have to make sure that that information is safe.
So what recommendations would you give out to other physicians out there, Doctor?
One is you should always have written guidelines within the practice. You should have a compliance manual. You should have a physician champion who takes charge of HIPAA regulations, changing guidelines, and a very good HR department who can funnel this through to the practice. Not only that, you need the best resources with an IT facility and company that can protect everything within your practice as if it were their own.
Hi, I'm Nelson Gomes. Patient privacy and security is our priority one. Contact us to learn how we keep your patients from being a cybercrime statistic. Technology made simple. Imagine that. Okay, so that was a shameless plug at the end there. That concludes our presentation for today. So I'm open to any questions at this time. So Dawn, go ahead, take it away.
Okay, Nelson, thanks so much. Folks, if you have any questions, please type the questions in the question box at this time so we can get to them. Nelson, I only have one question up so far right now, and it's in regards to getting a copy of the presentation. And as mentioned in the beginning of the webinar during the introduction, we will be emailing the presentation to all participants today. It will also be available as a recorded version in the members-only section of the NJMGMA website in the archives. So it should be up within 24 hours there. Folks, if there are no other questions, we're going to close the webinar. I'll give it a couple seconds here.
And once again, if for those of you who are attending MGMA, it's a great event. We highly recommend that you attend it. We are going to be talking about this. This is a big topic, so I highly recommend that you attend that session and many other great sessions that MGMA is putting on this year. So looking forward to seeing you there.
Okay, Nelson, thank you. It looks like you did a fantastic job today. I don't have any questions coming across, so I'm going to go ahead and end the webinar today, and I thank you all for attending.
Thank you.